Welcome to Module 12, focusing on osteomyelitis and deep tissue infections. By the end of this session, you will be able to define osteomyelitis and deep tissue infections, and understand their causes and clinical signs. Identify risk factors and recognize early indicators of bone or deep soft tissue involvement. Apply appropriate diagnostic tools and interpret results effectively. Understand treatment options, both medical and surgical, for these complex infections. And finally, carry out nursing responsibilities to monitor and manage these serious wound complications. Wound infections don't always stop at the skin. They can travel deep into muscles, fascia, and even bone. Osteomyelitis, or infection of the bone, is a severe condition. If missed or mistreated, it can result in long-term antibiotic therapy, hospitalization, or even amputation. Similarly, deep tissue infections, such as necrotizing fasciitis, are rapidly progressive and potentially life-threatening. Nurses often play a critical role in recognizing early changes that signal these complications. So let's dive deeper. Let's begin by understanding what these conditions are. Osteomyelitis is an infection of the bone. It commonly occurs due to spread from overlying infected tissues, like diabetic ulcers, direct contamination through trauma or surgery, or hematogenous spread, which is more common in children than adults. Once inside, the infection disrupts blood flow, causing bone necrosis and making antibiotic penetration more difficult. Now, for deep tissue infections. These include conditions like necrotizing fasciitis, involving the fascia, myositis, muscle infection, and infections in tendons or joint capsules. These are medical emergencies, often leading to sepsis and organ failure if not identified early. What puts someone at risk for these infections? Risk factors fall into three main categories: patient-related, diabetes, peripheral arterial disease, renal failure, or immunosuppression. Wound-related, chronic wounds, pressure injuries over bony areas or exposed bone. Systemic issues, malnutrition, poor glycemic control, recent surgeries, or trauma. These risk factors can help you identify high-risk individuals even before clinical signs appear. How do these conditions show up clinically? For osteomyelitis, look out for wounds that don't heal even after 4 weeks. A positive probe-to-bone test is a strong indicator. Persistent drainage, exposed bone, pain, swelling, and possibly fever are all red flags. For deep tissue infections, the pain might seem way worse than how the wound looks. Rapidly spreading redness, crepitus, a crackling sound, or visible skin necrosis should ring alarm bells. Fever, confusion, or hypotension may suggest systemic involvement, possibly sepsis. When you suspect osteomyelitis or deep infection, timely diagnosis is critical. Laboratory tests, WBC count, ESR, and CRP will often be elevated. Blood and wound cultures help pinpoint the organism. Imaging. X-rays may show bone changes, but only at later stages. MRI is the gold standard. It picks up early infection. CT scans are helpful for detecting abscesses or sinus tracts. Bone scans can reveal metabolic activity and inflammation. And of course, the probe-to-bone test is especially helpful in diabetic foot ulcers. Management must be swift and comprehensive. Medical treatment begins with systemic antibiotics, usually IV for 4 to 6 weeks for osteomyelitis. Broad-spectrum coverage is often needed, targeting Staphylococcus aureus, including MRSA and sometimes anaerobes or gram-negative bacteria. But antibiotics alone may not be enough. Surgical intervention becomes necessary when there's necrotic tissue or abscesses. This could range from minor debridement to major surgery. In extreme cases, amputation might be the only option to prevent systemic spread. Negative pressure wound therapy, NPWT, may aid recovery after surgery. Nurses are the frontline defenders. Here's what you're responsible for. Monitor the wound closely. Check for drainage, size, depth, odor, and exposed bone. Use pain scales and monitor for signs of systemic infection like fever or chills. Ensure IV antibiotics are administered safely and monitor for side effects. Coordinate lab and imaging follow-ups. Prevent pressure injuries by repositioning and using appropriate support surfaces. And most importantly, educate patients and families on warning signs, wound care, and adherence to antibiotic therapy. Education can prevent readmission and serious complications. Teach patients and families to report fever, increased pain, or foul-smelling drainage. Strictly follow the antibiotic regimen, whether IV or oral. Learn and perform proper wound dressing techniques. For diabetic patients, regular foot checks are essential. Promote healthy habits, good nutrition, quitting smoking, and managing blood sugar effectively. Let's wrap up. Osteomyelitis and deep tissue infections are high-stakes complications. They require early recognition, prompt treatment, and a multidisciplinary approach. As a nurse, your vigilance, your attention to subtle wound changes, systemic signs, and patient education can mean the difference between healing and life-altering outcomes. Stay observant, stay proactive, and continue being a powerful advocate for your patients.